My name is Brad Rapheal. I'm one of the orthopedic surgeons on faculty at St. Joseph's Hospital. I'm also assistant team physician for Syracuse University and various local high schools. I'm also a partner at Rapheal Sports Medicine, which is a division of RSM Medical Associates. And I thought I'd take a couple minutes today to tell you about ACL injuries. So, treating sports injuries like we do in our office, we are often faced with ACL injuries. So basically, I figured the best way to explain what an ACL or anterior cruciate ligament injury is with a model. So if you think about it, the model of your knee, this is your thigh bone and this is your shin bone. And I've taken away the kneecap to expose the ligaments inside the knee. So if you can see, right in here is your ACL, your anterior cruciate ligament. Now this is important because this ligament prevents the knee from shifting back and forth and also prevents it from rotating too much out of control with activities of daily living or sport activities. So why is it important? Well, when you rupture your ACL or you tear your ACL, your anterior cruciate ligament, your body has a difficult time repairing it. It doesn't heal on its own because in the knee where the ligament is, there's a very poor blood supply. Other ligaments in the knee do have a good blood supply and often do not require surgery. However, the anterior cruciate ligament, the ACL, usually does require surgery. And it usually is not something where you can just sew it back together, but it has to be reconstructed. In order to do that, we reconstruct it with drilling tunnels through the shin bone and your femur bone so that we give you a new ACL. Now, the important thing is, where do we get the tissue from? So it's important that you ask your surgeon what would be the most appropriate ligament for you. There are various different choices. You can choose from a cadaver or an allograft or your own tissue, which we call autograft. The most common, if you choose your own tissue, is from your hamstring or your patella tendon. There are advantages to all of these choices and sources for your graft. And I recommend that you find a surgeon that does feel comfortable with all of these types that can find the graft that's most appropriate for you. Now, who does need this surgery? Well, not everybody needs their ACL. Many times when you rupture your ACL or you tear your ACL, many people don't even need to have surgery. However, the ACL is important because if you want to get back to an active lifestyle of running, football, soccer, if you're a young high school or college athlete, you need your ACL more than you do when you get a little bit older with age. So therefore, in a young, active individual, we do recommend a reconstruction. However, with age, the ligament is not quite as important with day-to-day activities. So it's important that if you do unfortunately sustain one of these injuries, that you find a surgeon that does feel comfortable with the operation and with all the different graft choices. And should you have any questions, you can call our office at 701-4024, and we'd be happy to talk to you about the various options for your ACL surgery. Thank you very much.